Thank you, David. Aziz has a taxi at 5:35, so I'll only speak for 2 hours, just to... But what a fantastic day. And can I congratulate you on your first 1,001 days. But I think today has been, quite rightly, it was framed as a celebration. Much better than watching Wimbledon, I think. Although Heather Watson did win for once. And certainly much better than learning that there's a proposal for another Scottish referendum on the 19th of October next year. So pack your bags, Aziz. But I'm going to try and convince you in the last 5 minutes or so that this is important and that actually you as a community are at the cutting edge of a revolution of how we deliver healthcare. So that's why I'm going to convince you. But don't believe me, believe The Economist. And I was sort of scanning it, not during the talks, I should say. But there's a whole section on tech in healthcare in this week's Economist. So let's look at the macro. So the phrase from The Economist is, rich countries pour heart-stopping amounts of money into healthcare. And that is true. So ONS last month looked at healthcare expenditure in 2021, and we spend in the UK £277 billion a year, both governmental and non-governmental, which means in the last 24 hours that we've met, the UK has spent £750 million on healthcare. It is eye-watering, but it's worse in America. You know, our GDP spends about 11.9%. It was 9.9 3 years ago. In the US, they spend $3.6 trillion on healthcare, which is 17% of GDP. So this is not sustainable. And if we look at the productivity of health systems around the world, they're characterized by waste, variation, and harm. And as you know, productivity in the UK is flat-lined. So when we look at the health service, the only way to really look at productivity is through innovation. And data-driven innovation is at the heart of that. And if we're going to deliver on so-called 4P medicine, which is precise, participatory, personalized, and predictive, it all has a foundation on data in near real time. So this community is very important, not just for individual diseases, but actually, can we define new models of care which improve healthcare delivery at scale? So in terms of reflections of today, I have 5, and I'll just quickly canter through these. Firstly, and Janet Valentine reminded us of this, the prize is absolutely clear. This isn't, you know, the whole world is grappling with this. And the prize is, how do we work together to assemble and maintain the integrity of a trustworthy health data ecosystem, initially in the UK for 66 million people, but with international linkages, because the pandemic has shown us that this is a global challenge. So Janet said, you know, the prize has been clearly defined. The challenge, as ever, is delivery, and delivery at scale. And if we do this once, and we collect data once, use it often, primarily for patient care, the cascade benefit for planning, management, and research and innovation is fantastic. So the prize is clear. The second reflection is, let's put patients at the heart of everything we do. And again, this isn't new. It was Osler, who was the sort of father of modern medicine, who said, listen to your patient for long enough because he's telling you the diagnosis. So working with patients and populations is absolutely, it's a golden thread of everything we do. And Rory today, he's left, but didn't he speak with great humility and used his own challenging medical history to tell us about how it was important for patients. And actually, the guiding light of patients can be very thoughtful and instrumental. And I wrote down his quote. He said, he had a light bulb gobsmacking moment that there was a problem to solve. And if we work in partnership with patients, the problems will be solved easier and better. And it's fantastic to see the PPIE activity across all the hubs, the Alliance and the Gateway. And I remember when I was seeing patients with diabetes, a patient rushed into my clinic and he said, I don't care whether I belong to primary or secondary care. I just want a good service that covers all my needs. So we mustn't allow our organizational fragmentation to conspire against us. The third reflection is scale. And Mark Walport, he was great. He only had one niggle, you noticed. And his niggle was that we as a community had not become more coherent as a hub network to scale to 66 million people. So I do think scale is going to be important over the next 3 to 5 years. But this is about coordination and connectivity, not command and control. Because we have to allow folk to flourish within an ecosystem so that this data as infrastructure provides services upon which many applications can flourish. And I remember in the early days of the Hub program, I went to see Doug Gurr, who many of you will know is now the director of the National History Museum. Yep. At that time, he ran Amazon in the UK. And actually, the Amazon model is quite similar to what we're trying to do here. He says, we're infrastructure as a service, platform as a service. What we try to do is connect content providers with consumers and give a fantastic experience. And if we're going to pool this UK data ecosystem in a trustworthy way, we've got to think about how we do it. Scalability, reliability, sustainability, security, interoperability. Fourthly, to do that needs partnership, arguably on a scale never seen before. But this triple helix of the NHS, academia, and industry co-creating for public benefit, it's hard, but we'll need to do it for the benefit of the patients. And if we're going to deliver on patient care, management, planning, and research, it will ensure and it will require us all conceding a bit of sovereignty across our organizations. So I think that's an important part. So partnership at scale. And it's terrific to see the focus on data within the NHS England plan. I think it's absolutely magnificent. But the opportunity now, under Claire's leadership, is to develop joint strategy that's clear, a single map for the UK. And lastly, this is about impact, and this was one of Mark's points. So it's not about build it and they will come. I think we need a constant drip, drip, drip of stories of how it's making a difference to people's lives, either at the individual, locality, regional, or national level, and start to see how we address the non-COVID pandemics of cancer, cardiovascular disease, respiratory disease, because it's the same heavy lifting. It's the same data engineering. And we should recall it's tragic that 175,000 people have died from COVID in the last 2 years, but 168,000 people die from cancer every year. So how do we take the learning beyond COVID? So looking ahead, and I commented last night, success is a journey, not a destination. These hubs are still very young, and I do go back to my Gates quote that we overestimate what we achieve in 2 years and underestimate what happens in 10. So I would encourage us to continue with a spring in our step, maintain the community to deliver great things. So as you know, I often use quotes to try to inspire people, but I was running out of inspiration. So I looked to Spike Milligan. Do you remember Spike? So he's famous. One of my favorite Spike Milligan quotes is actually on his gravestone, where inscribed is, "I told you I was ill." But he also said, "We haven't got a plan, so nothing can go wrong." But that's not the position we're in. I think we've got a plan for the UK. we've got the partnerships, the expertise, the interdisciplinarity, and the public support to deliver. So I think the inflection point is here. Working in partnership with patients and the NHS is essential, and there's a great opportunity for this community to grow, to expand, to deliver great impact and benefit for the public in the UK and beyond. So can I thank you for being great leaders, great participants, and a great community. And let's continue to do great things. So thank you.